So today I'll be talking about cerebral palsy, which is a group of neurological disorders that is caused by abnormal brain development or injury to a developing brain, which is usually before birth or during birth or in early infancy. It mainly affects movement, muscle tone, coordination, and symptoms can vary widely, person to person, case to case. Um, from anywhere from mild delays to significant physical disabilities, speech disabilities. Um, there are a lot of risk factors, so anything from premature birth, low birth weight, maternal infections during pregnancy, lack of oxygen during birth, and there are certain genetic or developmental complications. Now, cerebral palsy does not worsen over time, but the effects can change as the child becomes older, and even more noticeable as when motor skills are supposed to be coming in and the child begins to fall behind on basic development milestones. So the ultimate prognosis of CP or cerebral palsy can depend on the type and severity. Most people do live long, full lives, especially if they get early intervention therapies, medications, anything that'll help them just be able to cope with cerebral palsy. And they also can be very independent as well, as long as they, regularly attend therapy. So as for my personal loved one, I have a cousin. She has moderate severe cerebral palsy. She was born with it from a complication during birth, and she's 33 years old. She is somewhat active. She's able to walk. She cannot talk, but she can do activities for herself, like taking herself to the bathroom. She can eat by herself. She can do certain things like that. However, it is you can tell there is a significant development delay. She can only eat soft foods, unfortunately, but she also does have a very good social life, among others who also have similar disabilities as her. She is completely adherent to all medical treatments, from anything from daily treatments to weekly or monthly therapies, and she has been doing that since she was born. Going to therapies, having surgeries, anything that was needed was done. Personally, I support her by helping her eat sometimes when we're out in public, or setting up her daily tasks so that way, like, she can brush her teeth and be more independent. I also sometimes I will have to help her shower because she cannot fully shower by herself. But those are the things that I do that will help her out. I also can help her walk around. She is able to walk around by herself, but she does have a slight limp, and sometimes if the ground is very uneven, she can trip very easily. So usually if you just guide her by the arm, she can walk just fine. But those are the things I do to help out my loved one, and that is cerebral palsy for you.